am. Thank you.
So hi, everybody. It's a pleasure to be here. My name is Yvonne Eaton-Stahl, and I am an associate professor in social work at Slippery Rock University in Pennsylvania. It's a little bit north of Pittsburgh, for those of you that may know Pittsburgh. When I say Slippery Rock, everybody always says, there's really a place called Slippery Rock? And there is. But just by way of a little bit of an introduction, I have always been very interested in forensic social work. My master's focused on that, and I have a certificate in forensic social work. And then, of course, my strong interest in animal-assisted social work. It's a good partnering, and I'm going to turn it over to Cindy, and then we'll hear a little bit about you guys.
All right, thanks, Yvonne. My name's Cindy Wright. I am a regional licensed psychologist manager for the Department of Corrections in Pennsylvania. We're going to show you a map later that'll show you Pennsylvania and all the prisons in it. So I manage all of the prisons on the western side. I have 2 therapy dogs, and I've been in the government, type positions for, I don't know, I think it's like my 27th year or something. But I've had the luxury of working with all kinds of prison populations, as well as students, college students, all kinds of groups.
All right. So before we get started on the actual presentation, Cindy and I like to know a little bit about your background. So hopefully you're skilled at managing your Zoom, and you can either use your phone to do this little survey, or if you minimize the Zoom, you can use, open up another browser to fill out our survey here for us to give us a sense. So if you go to, you can see that okay? Yeah. If you go to menti.com and you enter that code that is appearing on the screen, it's going to prompt you to fill in your level of experience working in prisons or jails. So we only want you to answer one of these choices. So please make sure you read all the options before you select one. But we want to have a sense of who we've got here. So if you've never worked in the prisons or jails, some experience, currently working, and then currently working and working with AAI in prisons. So we'll give everybody a few minutes to please fill that out, just to get a sense of people's experience levels. And while we're waiting for everybody to finish that, although I mentioned my experience currently working in a university setting, I worked in a maximum security prison while I was completing my master's degree. And then my current research interest is, working in the prison. And I've been fortunate enough to get to know Cindy and really develop a great partnership that we have, and be able to develop some pretty neat interventions for the prison populations in Pennsylvania. All right.
And I've been the lucky one, so let's just put that out there.
All right, well, it looks like, it's slowed down here, so you can feel free, if you haven't quite done that, to still do that. That will give us a sense who was here, but I appreciate that.
Interesting.
And then the next survey, I'm hoping that you'll just indulge us for a minute, is to think about what you would view as the biggest challenges or concerns that you personally have experienced. For those of you, that 3, I think there was, that are currently working in a prison, that are doing some sort of an animal-assisted intervention program, you can go to Menti again. There's a new code. Enter concerns or challenges that you would experience or anticipate in doing animal-assisted therapy in a prison or jail setting. Cindy and I are hoping to get some sense of what your concerns or challenges might be, so that we can then offer you tips to possibly deal with these challenges or concerns.
Yeah, even if you haven't worked in there, what you consider, what you think might be a challenge, or even a fear that you might have.
Oh, love these, love these. This is very, very good.
Mm-hmm.
Oh, fantastic. Love it. And these are definitely some of the things we had planned on addressing for you. And then hopefully this will give us some other ideas of things you might want us to help you think about, that you can possibly implement this near you. Fantastic. Thank you all very much for that. And Cindy will probably jot some notes down that we can give you some.
Did you see me with my specs on? I was writing notes.
All right. So we're going to go ahead and get started on the actual presentation. And just so you know, we actually are going to present two different prison programs that Cindy and I have implemented. And so what we thought would be most helpful is to offer at least a middle question section, sort of when we finish the one prison example, and then we'll move into another, so that if people have specific questions related to one population, we would offer 2 times for questions. So our objectives for today, we are going to present to you 2 different prison projects that we have done. And being a social worker, I didn't just have an interest in, doing surveys and asking people about dogs. I really wanted to do actual interventions. And luckily, when I met Cindy, she was right on board with that. And so we are going to actually share with you animal-assisted therapy interventions that we provided. And we're going to share experiences from a male prison, in particular, stress and anxiety groups that we ran, and then in a female prison for individuals with histories of self-injury. So these are our objectives for today. Obviously, we're going to address some of those concerns and challenges that you mentioned, and we're going to offer you some tips. So hopefully you can leave this webinar today having some ideas on how to manage some of the challenges that you could face working in these settings. We're also going to, the second objective really, we're going to give you some ideas about how to integrate animal-assisted interventions with our particular groups. In particular, we utilized, the groups that we ran had a strong CBT focus and DBT focus. And so we're going to give you some specific strategies for integrating the therapy dogs in that group. And then we're going to, of course, share with you what we found from our particular interventions. Just to get us started, a great national survey that was conducted by FIRST sent surveys out to the 50 states in the United States, and FIRST actually was able to receive responses from 46 of the 50 United States. And out of those 46, 10 of those states did not identify having any kind of prison dog programs. But out of the others, what FIRST found was the biggest type of prison dog program was community service, where Shelter dogs, for example, were placed for a period of time in the prisons or jails, and individuals would then work with those dogs on basic training to hopefully make them more adoptable. So, some basic training skills, how to behave, not jump on people. And I think that First found about 34%, close to 34% of the programs fit that criteria. The second highest was service dog training programs in prisons, where puppies were matched with individuals who were incarcerated, who then worked on specific training, skills training, to hopefully develop a dog that could be a service dog for an individual with a disability. And I think that First found about 21% of programs fit that category. But one of the things when I read this that from a therapist standpoint concerned me is that there was very little animal assisted actual therapy interventions for the individuals who were incarcerated. So this was where I wanted to, see some changes. And I'm going to turn it over to Cindy to tell you a little bit about the Pennsylvania State Prison and where things fit and why we wanted to go this route.
All right, so there's our map. There are 24 state prisons or institutions in Pennsylvania. That includes a boot camp and 2 female prisons. The female ones are in red. The boot camp is in green. The one that is in purple is actually young offenders. So those would be the folks who are, 18 and sometimes below, 21 and below. So where Pennsylvania is coming from, I think is a little bit advanced as far as the dog part of it. Every single one of these institutions has some sort of dog program. In about early 20 teens, early to mid 20 teens, they started from the administration at the top, actually requiring every superintendent to implement some sort of a dog program. And some of them came kicking and screaming, and some of them thought it would be great. Now it's everybody. It's one of the highlights of the tours. So no matter how much they hated it in the beginning, everybody finds benefit now. And so the programs are very different. Some of them are like Canine Partners for Life. They train, service dogs and home companion dogs, even courthouse companion dogs. We have some that are service dogs that are placed with veterans for specific needs. Some are, for individuals with mobility or hearing, autism, PTSD issues, a number of different organizations. And then they also have, again, what Yvonne was talking about would be just your basic shelter dogs that we would come in and the inmates would train them on basic obedience, crate training. Frequently, they also have them, they get the Canine Good, it's not Canine Good Citizen?
Yeah.
Okay, that certification, if they can, so that they come out and people know that they're adoptable. And that makes a big difference. But when it comes to actually, any animal assisted intervention, we don't have anything other than what Yvonne and I have done. The closest that we have come is that that sometimes we are able to get some of these dog programs, get them to come to, say, a residential treatment unit, a unit for those with mental health issues, and come over and spend an hour or so a day just interacting, and so they can pet them. But the importance of this, and I think what everybody has found, is that there's a real shared responsibility between the volunteers, the trainers, all these organizations, and then the inmates and the staff. It really influences the culture of your facility. It even results in some job opportunities for our reentrants, provides services, provides smiles. I mean, it really makes, I think, a big difference. People just feel a little brighter when they see a dog.
So we also want to talk to you a little bit about the procedures involved. And this is something that when you're going to implement a program in the prison, I mean, Cindy and I think we started about 6 months in advance of implementation to accomplish all of these steps that we had to do. So I'm going to let Cindy just start off with how she got administrative approval first, and then I'll cover some of the other items.
Okay. So this is one of the things where you have to know your place, your institution, and really get a feel for it, because you have to do a number of things. You have to get administrative buy-in at the local level first, to get them, to see that it's a good idea, but then you also have to get approval through the prison's IRB system, and you can't really do one without the other. You could do, start with the overall IRB, but we also have to keep in mind that superintendents are there, they run their jails, and it's very important that they are okay with something before it comes down from above. I think that's really important to remember, so that even if the administration approves it at the central level or your administrative level, you definitely want to get a lot of buy-in from everybody locally. And so, we filled out a bunch of forms. We got it all approved from both levels.
And I can mention a
go
little
ahead.
bit about
Yeah.
the university institutional review board process. For those of you that maybe had to have research approved from a university college setting before, it is a little bit of a process. And because prisons are considered vulnerable populations, that meant that our whole proposal had to be a full board review. So I had to physically go and meet with the IRB, present the research, answer their questions, and seek their approval at that level first. And that was necessary before the state Department of Corrections would give us approval to go in the institution. So we actually had to get that university approval first. And then when we submitted the state approval, we were able to demonstrate that we already received university review and approval. The other procedures that were involved included the clearances. So for those of us, unlike Cindy, that didn't work in the prisons, we had to go through their clearance process. So myself and my research assistants and the other therapy dog handlers all had to submit paperwork and get cleared by the prisons to be able to go in and to have direct contact with individuals who were incarcerated. We also had to complete an orientation with security officers who educated really all of us about important things like not providing personal information and things that, as a social worker, I know that, but maybe some of the therapy dog handlers were not as familiar with this. So they provided an orientation in advance so that people were more comfortable with that. We also had to identify if there was anybody in the institutions that anybody could have possibly known, so that was made aware from a security standpoint ahead of time.
And you also have to go through a PREA orientation, and that would be consistent across the United States, because PREA is federal. Not sure internationally what you would need, but that's a big piece too.
And we wanted to talk about who to select and who to screen out. So I'm going to have Cindy talk a little bit about that.
All right. So so we knew the kind of population we were looking for, but we also wanted it to be a voluntary. So what we did is we put out flyers on the housing units, and we talked to staff about the program, and so that they could kind of pick some people that they thought would be of benefit. Now, we also have a mental health roster, and we have a psychiatric review team. And so all of the folks were reviewed by the psychiatric review team as well, to see who, who we would benefit. And then from those who volunteered, we picked them based on the level of of need that we thought they had, or if we were looking for a particular diagnosis or a history. So that's how we screen them. Now, that's how we initially brought them in. And then when we screened them, we also wanted to make sure that we didn't have anybody who had committed an offense against an animal, nobody who had had a violent misconduct within the last, or violent behavior within the last 6 months, nobody with any serious allergies to dogs, or anybody with any strong fears of dogs.
Thank you, Cindy.
Mhm.
And the other procedures, just to mention, is every time we went to the prison, myself, my research assistants, the therapy dog handlers, and the dogs all had to go through the metal detectors and go through the security process. So you can imagine sometimes there could be a little bit of a delay in actually, getting back into the prison where we needed to do the groups. And also the prisons would do random ion scans to determine if, any of the handlers or the dogs had any evidence of substances. So moving on to talk a little bit about some of the challenges and risks. Cindy's going to cover the first 3, and then I'll cover the last 2 there.
Okay, so this is my favorite section, and that's because to me, a very part of my education has always been in learning what not to do and what I don't want to do. So I want to talk about quite a few of those because there are a ton of challenges and things that you really have to consider. First thing is staff buy-in. You may have administrative and all kinds of approval, but if you don't have buy-in from the officers and those front level staff, you will probably have a terrible time. You have to make sure that those folks see this as something that is going to be good, that it's worthwhile, that you have a relationship with it. And you have to build rapport, so that, for instance, so that when the inmates are to be coming over, to the group, that they actually call them, that they actually send them. For instance, when we had, we ran our group on a 2nd floor of a building. And so individuals come over and they are, the officer takes their pass, and then we come down, take them back up to the room. And then when they're done, we bring them down. Well, a couple of times we had some trouble with, like, there was nobody around. Like we were missing a lot of people from our group. And when we went downstairs, what we found out is that several people had come in late, 5 minutes late maybe. But because of that, they wouldn't let them come up. They also wouldn't call, even though I had a radio, they wouldn't call to say they were there. So they just sat there for an hour and a half or however long it was that we had them there. And because even though I knew that and I knew to build that relationship, you also have to consider that there are, there's all kinds of things. Staff are relieved for all kinds of different reasons, for lunch, for other stuff. So the staff that's there right then, there could be somebody else for an hour and you don't know it. So you really have to think about that and try to get that relationship so they will call you. The other thing would be, what we did after that was then, after a few minutes when people were up, I would go back down again and make sure there wasn't anybody else there. So that's important. When you're scheduling, you want to make sure that you're cognizant of things like count time and change of shift. So you do not want to schedule any meeting that any group that would come or leave around shift change. So for shift change, you don't want anything going on 15 minutes before, 15 minutes after, because everything shuts down at shift change. Count time, the same thing. So at count time, count typically will clear within a certain amount of time, and you'll know that from your institution. However, it doesn't always. So if you're cutting your time really close to where count is, you're probably going to end up with not getting your full time in. Another thing to really consider that you wouldn't think about this, but is lunch. If you're scheduling somewhere near lunch, you want to give plenty of time for the difference in lunch, because sometimes lunch is pizza, or lunch has some sort of specific thing, that's good. There's cookies that day. And so lunch can go twice as long as usual. And that can mess up your whole thing as well. And again, these are things we've learned. So you want to definitely think about that. The other thing too is you want to schedule your group to start. You want to schedule it for 15 minutes before you actually want to start, because very often the time that is on the call out sheet or whatever your institution uses for them to come over, they will send them at the time that it says, even though that's the time for the group to start. So you always want to give yourself 15 minutes leeway in between, so that you can actually have people there on time, so you can start on time. Another thing to really think about is when you're scheduling this, you need to look at the folks' schedules, because if they're in school or they have work, or a program such as a therapeutic community that is their whole day, there might be things they can't get out of. And so, for instance, if you're, we were running a couple different groups, and so that would make a difference as to whether we put them in a morning group or an afternoon group, because typically school is half of a day, but not the other half of the day. So those are all things to look for. Then you want to also make sure that the staff connections that you have in the institution, if you're coming from the outside, that they have your numbers and that they can call you, because there are lockdowns all the time. Some of them are planned and some of them are not. But even if they're planned for security reasons, nobody will know until they come into the institution, which also would be a good reason why you might not want to schedule like a group at the very first thing, because you could be on your way there when it happens. So if people have your contact information, that you're really checking that, so that you can let them know, because you can't come in once there's a lockdown. All kinds of things could happen, and you just will never know. So that's really important. And then, dress code, especially, coming from the outside, what you would consider to be normal attire may not. There might be things that you don't think of. So you really want to look at a dress code and think about that, especially if you're working with younger students, for instance. What students think is what their normal and typical clothing is, probably is going to be an issue in prison. Things like not wearing heels, having your toes covered. You have to wear shoes that you can run in just in case you need to. Stuff that you would never think of, that might look revealing inside but would be normal outside. There's all kinds of stuff like that. And then the most important thing is that you have to be very flexible, because security isn't convenient. And so you're going to have challenges of some sort or another every time, and you just have to kind of roll with it.
And the security processing could sometimes take a while. So when myself and my student research assistants would arrive at the facility, they could at that moment be discharging some individuals from the prison. And if that was happening, that delayed us getting processed through security. So we always had to sort of arrive early. And we also had to be aware that sometimes the security processing ended up stopping temporarily for whatever safety and security reason. So again, in order to make sure that we could get through there and get on the other side inside, we had to make sure that we gave ourselves extra time. The other thing around scheduling is we made sure that we did not schedule groups on days where visits happened at these institutions.
Yes, so I forgot that.
There were not, a lot of outside people coming to visit their loved ones on the days where we went, because that lessened the amount of people that needed processed. And then the last item was something that was honestly, from a dog handler perspective, was a little bit scary, but we had a couple instances where the institutions were locked down because there was a substance that was exposing the staff at these facilities to, and they assumed it was some fentanyl-like substance. I don't think we ever really heard what they for sure figured it was, but unfortunately, staff that then touched mail were exposed and had to be Narcaned or rushed out to the hospital. So that was very concerning to me, though, because even though they locked down and we didn't go in those days, I was concerned about what if an individual had something on their hands or they touched the dog, what were the ramifications of that? So one of the things that was very informative I want to share, I obviously consulted my vet right away and I said, listen, I'm concerned about this. If this is, an opiate or, some sort of fentanyl, what happens? What do we do for a dog? I want to be prepared to, manage that should it happen. And interestingly enough, my vet informed me that the Narcan that we use for people works on the dogs as well, which made us feel a lot better because the place where we ran the group was right next to the health center medical area where that was available should it become necessary. All right, so moving on, we wanted to make sure that we picked the right dogs for our interventions. And we did this based on a couple of things. Cindy and I both selected some dogs based on our personal knowledge and experience working with these dogs. And 2 of the 4 dogs here, one is mine and one is Cindy's. So the Black Lab Beagle is Chevy, he's my boy. And Ginger, the Shih Tzu, the grayish colored one with the blue bows in her hair, that is Ginger, that's Cindy's dog. But the other 2 dogs, we had a lot of experience knowing, and all of the dogs that you see were therapy dogs through the Alliance of Therapy Dogs, and 3 of the 4 dogs were animal-assisted crisis response dogs. And the reason I felt that that was important is because I know that those dogs have extra training, and they're pretty rock solid in terms of their ability to handle chaotic environments, unusual situations. Because when you think about a prison, there's an awful lot of people in uniforms. There are loud noises with doors clanging behind you, things that could be very frightening to dogs. And I felt that these dogs would be very comfortable. We also wanted to have a mix of small and larger dogs. And it was sort of funny because on one hand, Cindy's got the smallest dog, the little Shih Tzu there. And I remember thinking, I wonder how small dogs are going to be received in a male institution. Do they really want to admit that they, like to hold this little floofy dog, right? And one of the things I like to share is I remember when we were wrapping up one of the men's groups, one of the sort of tough guys there, he actually shared, he goes, I like Ginger the best. She was feisty like me. And he really, was able to identify with Ginger, the smallest dog. So that was neat. So that's a little bit about how we picked the dogs. So we're going to first start off talking about the men's stress and anxiety group.
Mm-hmm. And so I'm just going to say just a little bit about that. So in the Pennsylvania Department of Corrections, we are and have become the single largest provider of mental health services in the state. And that's due in large part to the decentralization of services and the shutting down of hospitals and programs where vulnerable people can reside, and so as that happened, starting in the mid 70s, the rosters just went up and up and up. And currently, our percentage is 36% who are active on our mental health roster. And what that means is our rosters are A, B, C, and D. An A would be someone who's never had any mental health history at all. A B would be someone who has mental health history but doesn't currently need service. A C is somebody who has a diagnosis and currently needs service. Usually medication, as well as therapy. D would be somebody who has a diagnosis that is considered a serious mental illness, including GBMI, intellectual disability, and autism. and of course, both also need service. So 36% are active right now, which is a large number of individuals. I think at the time that we did this, our population was 30,000. I think we've gone down a little bit, but and so, you know, that has caused a huge need for services. And then, you know, with that, you know, that's just the mental health issues. The stress and stress of being incarcerated is significant. You know, a lot of folks who come in because they have impulsivity and very poor coping skills. You know, acting out, impulsivity, substance use, all those kinds of things, and then put them into a stressful environment. In fact, I think there was a study from 2006. I think it was NAMI, that said about 56% of inmates in state prison experience severe stressor symptoms. You know, and that we felt that, you know, in order to successfully manage challenges, or, you know, that learning how to cope and manage challenges and to, you know, just kind of learn how to deal with stress is really critical to our mission of helping people to, you know, leave better than they came, you know, and to successfully integrate into society. And so it's a big job.
So just real quickly, this is our intervention team. And with every group that we ran with, this is the men's group, there were generally 2 dogs in the group. We've got our whole team pictured here, but in the back row on each end are the therapy dog handlers. And then in the back middle 2 were 2 of my wonderful undergraduate social work students. But I'll tell you, they were outstanding. And at Slippery Rock University, we actually have a minor in animal assisted intervention. So these students had that minor as well. So they had training in how to utilize therapy dogs in their work as social workers. So to give you a little bit of an understanding of the group for the men, we ran 3 10-week groups. A total of 24 men started and finished. So each of the 10-week groups had started with around 10. I think we had one that started with 9, but those were the sizes of our groups. And Cindy mentioned before that many of these individuals have a variety of stressors in their life. And one of the things that we wanted to know was what were their sort of top stressors that they were dealing with. And it's interesting to note that the number 1 stressor was actually family. So not seeing family, lack of communication from their family, lack of support from their family. So that was the number 1 stressor. And the number 2 was being incarcerated. But the format for our particular group, 10 weeks. So just so you understand what's listed here, session 1 and session 10, session 1 was the informed consents and the assessment measures, and an introduction to the therapy dogs after the assessment measures were completed. Session 10 were the wrap-up post-test measures, assessment measures. So the core content were the 8 sessions in between, and this was what we focused on each of those weeks. I'm gonna, in the interest of time, I'm gonna give you about 3 examples from the 8 weeks of content and how we integrated the dogs. So the stress indicators, that was a fun week because they were able to observe. So for example, Ginger, the small Shih Tzu, had not ever met Danny, the big collie here. And so at first, Ginger was a little bit leery of Danny, and you could see her stress signs. So it was a great example for us to talk about indicators of stress in the dogs first. And so they were able to point things out, or they were then able to start to share how dogs may show stress signs. And then we transitioned it, of course, to them. How do they show signs of stress? So we were able to get them to sort of talk about some of those indicators. In particular, we focused this section on physical, cognitive, emotional, and behavioral indicators. So we sort of, the students got everybody talking about all of those areas, relating them to the dogs, but more importantly, relating it to themselves so they could identify stress in themselves. Another group, that third one there, stress producing language. This was interesting, but I think we all know, if you have pets at home, if you yell at your dog or you come home and they've done something naughty and we use a certain language or say something negatively to the dogs, our dogs react to that. And that was a fun conversation because the men were telling stories about pets in the past and how their dogs reacted when they yelled at them, when they got into something. But it was a great tie-in to cognitive behavioral work and how what we tell ourselves in our head can increase our anxiety or our stress levels. And so that was another good example of how we integrated the dogs there. And then a final example, the coping strategies. So we shared a funny little collage that we created that had our dogs and different coping strategies they use. And they used a lot of laughter, which was a coping strategy in and of itself. But then they got to talk about ways that they cope. And going back to those stress indicators, we used coping strategies, physical coping strategies, cognitive coping strategies, emotional and behavioral strategies to try to get them to sort of increase their options. So the measures that we used were the Beck Anxiety Inventory. And for those of you who may have used that before, it's pretty easy. 21 items where there's a 4-point scale where somebody is reading the statement and then evaluating whether or not they've experienced from not at all to severely. The second measure that we used was the Coping Response Inventory. And in hindsight, we'll share with you that this particular survey method, I think we would both agree, was a bit too lengthy. It had about 58, 59 items and 4-point scales. So it took quite a lot of time because in the prison setting, we also had to read every statement just to make sure that if anybody had any kind of intellectual difficulties or couldn't read or write, that we could help them through those processes. The last scale is one that I really like. It's a pet bonding scale. It's one of very few that I've ever seen that actually evaluates visiting dogs, so therapy dogs visiting. And it's a 28-item scale where people rate things on a 5-point scale from more often false to more often true. And then we had just open-ended question where they could tell us anything that they wanted to about their experience in the group. So our results were very exciting. And really, this was the impetus for us to keep doing more in the prison settings. These groups that we just talked about all had dogs. So we didn't do, comparisons without dogs. All of the ones that we are talking about had the therapy dogs present. But we found there was a significant reduction in anxiety in the Beck. We also saw an increase in approach coping. And what approach coping measures is active efforts that people take to resolve their stressors. So we actually saw things where the men were coming into group and they were sharing like books with each other that they got from the library on Sudoku to, help each other to cope. Origami, I remember somebody bringing in origami that they had done and a book on origami to share with somebody else. We also saw an increase in seeking alternative rewards. And what this means is that they began to seek out new strategies to manage their stressors. And no surprise, because it really had a CBT foundation, we saw an increase in cognitive coping, where they were taking active steps to prepare for challenges, reframe their thinking into more positive things. And finally, that pet bonding scale that I mentioned, the ratings were amazing. with regards to how they viewed the dogs. So just to give you a couple examples from that rating scale, there was one statement that said they look forward to getting up in the morning on days when they were going to see the dog visitor. And I personally, that was rated very highly, like 4.7 on average for all of the individuals that participated, which from a treatment standpoint is fantastic. Because if they're getting motivated and wanting to come and attend group because there's a dog, what a great strategy we have. The dogs make me feel happy. Those kind of statements, the pet bonding scale rated. And I also like qualitative results. So over on the right, you can see some of the comments that they had about the dogs and the programming. And they really did feel that it was helpful. It helped them open up emotion and joy, all of those positive feelings that, quite honestly, I think some of these individuals had, very little of in their life to be able to have that positivity.
And just to piggyback off what you're saying, sometimes half or more of the struggle is just getting them to show up to the group. So, and that's not just in prison, that's, outside too, anywhere where you're doing. So, anything that would help to get them there so then they can get exposed to the treatment is a good thing. Especially, folks on parole and supervision, it's really hard. We did a little presentation, talked to some folks about that, that is one of their biggest struggles. So anything that makes them want to get up and come and help it out is a good thing. You would think that they don't have anything else to do in prison, but it's not true. We still needed them to come.
So we're going to get moving to the women's group in a minute, but I wanted to just pause for a couple of questions if anybody has any specific to the men's group that you just heard about.
Thanks, Yvonne and Cynthia. There's actually a fair amount of questions that have come in, and I don't know, I'm not sure whether they are specific to the men's group or not. I mean, they feel a little bit more general. It depends on how similar your studies are.
Yeah.
And so perhaps we'll let you do the women's part, and then people can kind of think about their questions, and then we'll go through them all. How's that sound?
That's fine. Absolutely. So we'll keep going here.
Yeah.
And then
Okay.
Yeah, because I looked at them too.
Okay, great.
Yep.
Thank
Yeah,
you.
I agree. They're
A little bit more general. Yeah.
Yep. So moving on to the women's group. So after we had this great success in the men's prison, I said to Cindy, let's move to the women's prison. What should we do? And Cindy said, oh, self-injury. And my first reaction was, oh dear, okay. So Cindy, you want to tell everybody about why we had a need for this particular group?
Sure. So, Rick, between 1980 and 2014, there's been a 700% increase in females being incarcerated. So that right there is horrible. Within that, then a great number of these ladies have self-harm histories. Obviously, they have tons of trauma. And then when you look at percentages, between 57 and 80% are on the active mental health roster. That's current from Pennsylvania. And there are 2 facilities, and then there's a DCC, and that's where where those differences come. The longer they're incarcerated, their need for services seems to go down just a little bit. But so there's, obviously a huge need, and self-injury is one of those things that is just so it affects everyone, the officers and the staff that have to come and, help and clean up the blood and take care of them, or watching, trying to keep them safe. The other inmates see that. I mean, it can be very traumatizing all around. So, and it's also one of those things that is incredibly difficult to treat. So that's why I felt like that was something we should really, we should address.
Thanks, Cindy.
Mhm.
So this was our intervention team for the women's prison. So again, I had 2 of my social work students. Again, social work majors, animal assisted minors. So the format for our self-injury groups is we actually wanted to do comparison groups here. So we had 4 6-week groups. 2 of the 4 did not have dogs, and 2 of the 4 did have the therapy dogs. The other thing that we did here was we got a small mini grant from the university to purchase workbooks. And the workbooks are provided on the reference page for you, but they were actually then Cindy was able to get approval that we could provide the workbooks to the participants, which I think was great because they really did utilize those workbooks. And we structured the groups sort of around the core 4 DBT skills that most of you probably are familiar with Linehan's model. The 4 main skills in DBT are listed there. And so the 4 middle sections of the groups focused 1 each on those areas. And that workbook actually has chapters on advanced distress tolerance, advanced mindfulness. So the ladies could then sort of go into a little bit more depth after group or, in their future, expanding on the skills that they learned. And like the men's group, sessions 1 and session 6 were focused around getting the informed consent, introducing what we were going to be doing, getting the assessment measures. In the women's groups, we ended up having a total of 35 women start and finish the groups. And unlike the men's group, the women's group had a much higher number of women with violent offenses. So it was like 57% with violent offenses in the women's groups. To give you just a couple examples here for how we integrated the therapy dogs. For distress tolerance, if you're familiar with that, one of the core skills are helping people to self-soothe with their senses. And so what we did here was we integrated some things like sight. So what they see about the therapy dog. So just seeing the dog or visualizing the dog would be able to help them self-soothe. Smelling the dog. This was sort of funny because they all ended up smelling the dogs. And I remember they were smelling Chevy's feet. And if you've ever smelled a dog's foot, they sort of smell like popcorn. So then all the ladies started to say, oh, it smells like popcorn. And everybody had to smell Chevy's feet for puppies. But touch too, and self-soothing with the senses there. One other example for mindfulness that I'll mention is we actually, for the dog group, did a single object mindfulness activity where they focused on one of the 2 therapy dogs. And we walked them through that mindfulness activity where they were asked to imagine, how does the dog look? Do they look soft or hard? Do they, some of the other questions we had here, do they have multiple colors or just one color? And then they got to reach out and touch the therapy dog and how did they feel? And so we helped them to, use their mindfulness skills on the single object of the dog. So those were the dog groups. Obviously, for the non-dog groups, we did a single mindfulness activity, but they could focus on anything in the room. The measures that we used for the women's group was a self-harm inventory, which is a 22-item scale that has a whole list of behaviors of self-injury where the women would indicate whether or not they engaged in that in the last month, and then they had to estimate approximately how many times they engaged in that form of self-injury. For this group, we got a little smarter. We used a briefer coping. The brief cope measure was a 28-item measure on a 4-point scale, and they would rate whether or not they have not been using this skill or whether they've been doing it a lot. And then we had qualitative questions. More or less, we had 2 of these. One of them where we asked them to just rate how beneficial they thought the group was on a 5-point scale, with 5 being extremely beneficial. And then we had the open-ended question about what one thing, single thing, did they feel was the most beneficial in the group. So here are our results, and very exciting, and probably no surprise to most of you there, our animal assisted groups in the women's prison had nobody drop out. And that, I think, is again, exciting in and of itself. The non-animal group had 3 dropouts. The other thing is attendance. The animal assisted group overall only had a total of 7 absences, whereas the non-animal assisted group had about double that, so 14 absences. So again, thinking about treatment compliance, what great results this has. We did see a significant decrease in the number of self-harm incidents for the individuals in the animal assisted group. And who knows why that is, but part of me thinks that maybe they realized if they engaged in that behavior, they wouldn't probably be able to attend group if they got sent to, the lockup area of the prison. We also found that both groups had increased positive coping strategies and decreased negative coping. But our animal assisted group did have better results. So the animal assisted participants had a significant decrease in self-blame, denial, and disengagement, and an increase in acceptance rates. And if you look at some of the positive quotes, one that really is just so touching. I mean, think about that. The only touch they've had in years. And it was really just so beneficial to see how the dogs could really help these ladies who'd been, struggling with, their mental health for many years. So here's a lot of our references that I mentioned for you. If you're interested and need anything, I'm more than happy to help anybody get things started in their area, and I know Dr. Wright is as well. Our contact information here, please feel free to reach out to me or Cindy. I've got both my email and phone number provided to you.
Awesome. Fantastic presentation. Yeah, thank you so much. So I'm just gonna kind of scroll back up to some of these great questions. So one of the first questions was, how did you specifically ask about animal abuse? Is there a review of criminal records or was this self-report?
Okay, that's mine. Let me hold on. And I wrote some of these questions down too. So yeah, I did a record review and looking for that stuff to make sure there wasn't anything there.
Okay, great, thank you. And then the next question was, for a screening process, would psychiatric stability be a consideration as well? And this person works with severely mentally ill, violent offenders. And given that that's a population that has considerable factor with animals and welfare concerns. So tips on determining that prior to patient inclusion. So kind of that whole area of screening.
That's where the psychiatric review team is very beneficial. So for what that means for us is it's a psychiatrist, the psychologists, the unit manager, the unit counselor, sometimes it's the unit officer, it can be, multiple people, medical staff. So we'd meet and discuss, whether or not that person we felt would be able to benefit, but also able to handle it, whether we thought that there were some issues with behavior or violence, or even, whether we thought that would be just too much for them. And that was really helpful. And then, but we wouldn't exclude anybody because of a mental health issue. and the violent part of it, I think that's taken care of by the 6-month no violent misconducts. So basically, we're looking for stability in behavior. So we didn't see any real problems with that.
I remember there was only one, well,
Mhm.
I'll share with you two sort of case examples that I remember. One was, there was one particular individual who seemed to be a bit delusional in their thinking patterns and became
Grandiose.
and sort of a bit focused on me, which then Cindy and I talked about this, and that individual did end up being removed from the group due to their stability. And then the other one that I recall was, there was one particular participant who was a little flirtatious with one of my students. And I remember, we talked about it afterwards, and we wanted the student certainly to feel safe and feel comfortable. And we basically said to Cindy said to the student, I'll remove them. But the student said, no, it's all right. We can develop a different strategy. So then I got to sit beside that person instead, and we didn't have any problems going forward.
And I wanted to address this because as the staff member in this group, it's important that I address those kinds of issues. And so the one who became grandiose and was just difficult, I basically talked with them and said that I didn't feel that they were appropriate, and that I made that decision for them to be out. We actually had and we've had some other things that didn't need that level of intervention. For instance, there was in one of our ladies groups, there was someone who just was monopolizing all the time. And so I basically pulled her aside and I talked with her, and trying to figure out what her motivation was, and got her to look at how when she talked, nobody else was able to talk, and that it was probably really important for everybody else to be able to, it was really important for everybody else to contribute, and what she was doing that was going to benefit everybody by allowing them to do that. And then I would, make contact with her here and there, and just sort of reinforce that positive behavior of her not saying something when she wanted to say something. And it actually turned out really well.
It did very well.
Yeah. So that kind of stuff, that in the moment thinking and changing, those were really good opportunities. And there was another, when looking at inappropriate behavior and concerns, we had one guy come over who was furious. He was really just, wanted to blow his top. And he wanted to be excused from the group, and I didn't let him. I mean, I didn't say no, but I suggested, how we do, right? Suggested that it might be a really good opportunity for him to process those feelings. And, he came in, he put the dog on his lap, he started petting. You could see the calmness coming. And this was somebody who wasn't, he was fine, but he wasn't really engaged. But after that, he was like the best participant in the group. He was totally engaged with others and helping them. And that was really great to see, because so many times that's what they want to do, is they want to, I have an issue, I can't handle it, I'm leaving. So this was his opportunity to face something and to see the benefit of that. So I really liked that.
Other questions, Lori?
Yeah, I guess and maybe you've already spoken to this, but were there any incidences in the group experiences that concerned you, for the animal or the inmate? And I know that you guys just gave a couple examples, but are there other things that come to mind? Or
I have to say, I had worries sort of ahead of time because of the dogs. But honestly, when you saw how beneficial it was and how it worked, I truly would have very little worry going forward. And that's why, I think we've continued to do this because we really see the value, and we had no issues. I mean, we had situations where the guys actually wanted to pick up the little dog and, needed help in how to do that properly. But it was really really beneficial. We had nothing I recall, right, Cindy, with the dogs that.
Mm-mm.
Yeah.
No, and actually that was something I was really cognizant of because, you know, one of my fears was, you know, these are a bunch of men. I have a pretty little dog and they're putting it on their lap. Okay. So I'm watching that. I'm keeping an eye out for that closely. And there was never anything that happened that made me concerned. Um, um, yeah, I mean, they were so good about that because they really valued it. You know,
And they
I
knew.
think partly talking it up too, talking about how important the group was and important, because we also talked about how, you know, we're going to do research, you know, because they had to consent to that, and how, if it's beneficial, that might improve, you know, the likelihood that these kind of things can come again and that we can get these kind of services for folks. And they really, really were invested in that because they really thought it was important. So they were all really on good behavior for that too. I never felt like I was real concerned about them. Now, some people ask questions just about, you know, fear of safety for their dogs, fear of them getting hurt, and also having like a place where they can rest undisturbed. So I wanted to address that. So, you know, most of the dogs that came in specifically for the group and then left after the group. So they didn't need anywhere to rest. Ginger would come in with me in the morning and she would leave with me at night. So she had all day there. I had in my office, I had a doggy bed and all that stuff. But, you know, you also have to really know your dog and you have to recognize when your dog's tired, or maybe they're not having as good of a day. And if that's the case, you know, you just say, she's not really having such a good day today, or, you know, or say she's done. She doesn't want any more of that, and pull them. And I had to do that once or twice. It was no big deal. You know, and I took Ginger other places too during the day. Because, you know, I had her there. I figured, why not? and it worked well, as long as I made sure that she was taken care of and I didn't leave her out or alone with anybody else. And that's another thing too. When you're doing these groups, you want to make sure that you have enough staff, whether it's staff, volunteers, you know, but you want enough staff so that people are watching for all kinds of different things. You know, like I said, like I was watching for anything going on, you know, with the inmates and the way they interacted with the students or with Ginger, you know, things like that.
And I also will mention, like, with the men's group, I did not have my own therapy dog. I was focused on getting the research to work properly and do everything that we needed. So I was an extra set of eyes for my students' safety as well as the dogs. But after that experience, I felt very comfortable. So when we moved to the women's prison, that's when Chevy, you know, got to do his work there as well.
Mm-hmm. Yeah.
Other questions?
Somebody asked whether, do you feel like there's something unique about dogs? Could other species be of benefit?
You know, I personally have worked in settings like a college counseling center, and I worked with the 2 therapy cats before, but unfortunately, I think that they ended up losing their jobs as a therapy cat because a little more challenging. I think that one of the, you know, the cat's behavior was problematic for the handler, because every time that she would attempt to bring the cat, it would urinate in the car on the way there. So I think it was a sign it didn't want to do it, didn't want to go anymore. But I do think that there, you know, could be some other benefits.
Yeah, we had a staff member who had a bunny who was really interested in maybe bringing the bunny in, and we just weren't able to make it happen because the bunny hadn't been certified, so it had to go through that process. But I really think that you know, multiple animals could do it. I think the keys are that they are the ones that have those more anthropomorphic features, you know, the larger eyes that are more baby-like, the ones that are more willing to, you know, that can make eye contact. I think that really helps make a connection. And of course, just the fact that petting them and them being soft. So bunnies, you know, like I probably wouldn't suggest a hedgehog, but I don't see where some of these others wouldn't do it. Some cats, especially like your Maine Coons, those that are more dog-like probably would be good. And it would just depend.
Yeah, the allergy factor would be probably more of a
Mhm.
concern.
Yes. Yeah.
I see that there was something about running a social skills group. Oh, I love that idea. And I will share with you that doing animal assisted therapy in other settings, one of the things that we did was let the individuals take the dogs with the handler with the double leash and walk and introduce the dog to other people in the facility to help practice those social skills. So if you had the ability to do that, I personally think that social skills benefits. I mean, we saw social skills benefits even though we weren't measuring that, no doubt, in our groups.
And one of the things, since we do have a smidge of time, I wanted to mention is that there's a huge benefit to the folks who work in the institutions with this. We had examples of people who would, I remember one officer told me, I wasn't feeling too good this morning and I was going to call off, and I realized that it was the dog day, and so I made sure I came in. People would look forward to it. People would talk about how it just made them feel better. It was real funny because sometimes I would notice some people who I knew were maybe stressed out, maybe chronically angry, stuff like that. They would just seem to find their way to wherever I was with the dog and be petting them. I mean, so, something else, when you're trying to sell this, if you're trying to sell it to an institution, there's a lot of other good benefits to the institution itself. We've seen, the research is real clear that working in a prison setting is very tough. I think every year the officer suicides are higher than the incarcerated individual suicides. Rates of PTSD are at or above those coming from combat. Even the folks who aren't folks who have worked, military folks coming in. But when you've got military folks coming in, you add that on top of it. I mean, it can be incredibly stressful. So anything that helps that helps the overall environment, it helps everybody, it helps the inmates, it helps the staff. It makes it a much better environment overall.
I do see a question about AAI during COVID restrictions. Mm-hmm. And there definitely has been, not with the prisons, I believe, but in other settings. I know I myself have continued to do groups virtually for a psych rehab that I work with. So we've been able to still run groups virtually. I will, my personal take on it is it's definitely not as beneficial as having the dog there and letting the people pet and interact, but it still has its benefits. So.
Looks like maybe we've got time.
I see a question about both.
Yeah, I didn't see all of it.
Both programs were animal assisted therapy with the handlers present at all times. Yes.
Was there a second part to that though? I thought
yes,
I saw
hold on
something.
here.
What is that?
Early on, the facilities have resident animals like the service dog trainings. And I don't know, I myself, just knowing my experiences where in my past, I had my dog all day with me at a facility. I feel that definitely is more stressful on the dog because of, it's a long day. There's a lot of different exposure. So, I mean, I would just have concerns about how we use dogs that are already at facilities 24/7 and putting them in another experience. But, I mean, I assume it could work. Cindy, do you have any thoughts on that?
Well, yeah, because I mean, I feel like it's a population there that I wish we could use more, but there are definitely some real considerations like you talked about, but also, these are mostly, a lot of them are shelter dogs and they're working through their own issues. You would have to make sure that they, that they were really ready. One thing we didn't mention is all our dogs had insurance, and that was something that's really important to the institution is that, even though I worked there, that my dog had insurance because they, didn't want to be responsible for that. And so, interacting that way with folks is, I think it's more risky, but I think that the longer the dogs that you have are there, the more you know them, it might be better.
So somebody
You
asked
know,
about the insurance. I mean, like myself, I have my insurance through NASW Assurance, and I basically purchase a rider. It's only like 20 extra dollars on my yearly liability. It's not much at all. It's well worth it.
Yeah.
I
I didn't
would
need to
go
purchase
back
it.
to that question for just a second, because I think the question of raising animals at the prison, and I think the question was more about how to keep those animals safe, or if you have welfare concerns about that type of program.
They are very well vetted before. There's a lot of criteria before they can be handlers. There's a lot of oversight there, at least in our settings. Always, you're always, of course, anxious, but I have never ever seen anything that made me uncomfortable. They just seem to care so much for them. Now, that being said, I have seen other things that have happened in other places. I think there was a county jail where an animal was actually killed, which just, it makes me sick. So I think that's where the quality of the administrative oversight, the quality of the program, all of that is paramount, because you do not want anything to happen to an animal. And that's why too, the animals, we had like different colors of leashes and things to show where an animal is, and whether or not you can pet them or not. You have to have a good quality program, and people who are really looking out for welfare of everyone.
Yeah. And I know Tia wrote about, like, your concern is how can you guarantee the dog's safety? And I know in a correctional facility, we can't guarantee our own safety sometimes.
Right.
So I know that is definitely a challenge. And it's something that I will tell you, some of the staff approached me at some of these institutions, and one of the staff said to me, I really would love to do an animal assisted anger management group. And I actually said, I really don't want to do that one. There's just one area that we already know there's significant anger issues towards others, and I'm not putting my dog at risk for that particular one. So I myself set limits with regards to thinking about that one going forward.
Yeah, that's a good point, because I would be uncomfortable. I might screen out for people with factitious disorders. Your especially your factitious disorders by proxy. Or I would be extra careful with them. I guess why it didn't feel as unsafe is because we're in a room that's relatively small. There's quite a few of us. My dog is not barely out of my arm's reach at all times. I guess I felt like I had enough control over the situation.
I was thinking about, Yvonne, when you were talking about that anger management groups, and this idea of this growing body of research that talks about the contagion effect of stress both ways, so long-term and short-term stress, and so between humans and dogs. And then I think about being in a room with that type of elevated emotion, and kind of the welfare ethical issues for dogs in that setting. So
I agree. And that's one where, I think about, in the past, one of my former therapy dogs was very attuned to emotional levels, both in myself as well as others. And I think that would have been for her a really draining experience. And that anger one is just something I'm not comfortable with.
Yeah. And while you were talking, it made me think, I just wanted to point this out, that those folks became so well in tune to our dogs and what they were feeling. I remember once they recognized Ginger wasn't feeling her normal self one day before I did, that they were that in tune. And that is one of those things that you know, until you get them actually looking at it, it's so hard to teach, you know, and yet it's so important for social communication and interactions and stuff that our population really struggles with. So, you know, that's really I think an untapped group where we could do a lot of good with animal assisted interventions.
But I agree. And I know we have to end for today, but I just again want to say thank you so much. This was fantastic, and it will be available on the HAI website soon. So if you know folks that might benefit from this, they can access it there. So thanks again, everybody. Have a
Thank
great
you.
Thank you
all
so much for having
being
us.
here. Yes. Thank you, guys.
bye bye.
Bye.